Okay, good morning, everyone. Dear students, today we will be talking on the medical record. Objective and emphasis. Objective of this lecture is to master how to make a history record and to understand the basic requirement for history record. So the questions that we will be discussing today: what is medical record, how do we make a medical record, and how to make a medical record. So these all questions today we will be discussing together and answering together and learning together. So the clinical record shows how the clinicians assess the patient, what plans they make, and how the patient responds to the treatment. And what are the um, significance of medical records? So number one is for the medical purposes. Second is diagnostic and treatment purpose. So this is the purpose. You have a good medical record, so it will make a diagnosis and treatment plans and things will make easier for us. And other thing here is teaching and research purpose. So like these data, like last time I given you the lecture of epidemiology, like we collect this data, and sometimes like some students they are doing some research, so they collect this data. When they have available records, so they take these records and then compare, and then they find some specific problems or solution for these things. Significance of medical record. So significance, one of the significance is it is for the legal purposes. For example, your patient presented to you in the clinic, and then a patient is dead for some reason. If you have not written the medical record, you will be in trouble because you will not have anything legally to prove that your therapy or something uh, that you have given to the patient was right, or the patient at the same time have the same thing. Like if you have given the wrong therapy, there will be the medical record. So patient and hospital and law enforcement agencies can they use this data and give the justice. To document insurance claim for the patient. If you don't have the medical record, how you will give the insurance to the patient, like how much cost, which kind of disease, what was the diagnostic test, and these all information. So the medical record is the document that you can also present for the claims to get the insurance, and to serve as legal proof in the case of malpractice claims for injury or compensation. As I have already told you, that if some mistakes from your side or patient side, so this medical record is a key which can claim for injuries and compensation and these all things. Basic requirements for medical record. What are the basic requirements? These basic requirements are like to be well organized and complete. So that's why I taught you the how to write the history taking, because that thing is a standard, and this how we write this thing in an order. So it should be well organized and completed, to be objective and accurate, to the point and accurate. You should not be involving in this too much, useless stories or something like that. So it must be objective and accurate, and using professional terms to record. So all the time you should be using some professional terminologies to record, because its record of this thing should is always in the hospital, or you also give it to patient, but it's only used for by doctors and these health professionals. So it should be in a professional way, that tomorrow if they claim something or talk on this something, It should be professional, so it will be easy for these professional people to understand it. And remember always to have your signature, because without your signature, this medical record will be fully, invalid. So your record, and if someone else added something or record and then signature or something, then it's also, creating trouble, can create trouble for you. So always remember to have your signature. And also, one point I want to add more here, that when you are writing the medical record, please do not make too much cutting, crossing, and these kind of things. Try to write it as much as clear and beautiful as possible. Types, formats, and contents of clinical records. So today, talking on this next section is types, formats, and contents of clinical records. Okay, so inpatient medical record is a case record, first record of admission, record of course of disease, record of consultation, record for transferring to new department, record of discharge, record of death, and record of surgery. So this is the inpatient medical record contents. So we will go one by one. So we'll see what is case record. So this is the case record. For example, journal data. Last time I taught you chief complaint, history of present illness, history of past illness, and review of system, personal history, marital history, menstrual history, reproductive history, family history, physical examination, laboratory test and instrumental examination, summary and primary diagnosis. So last week we have discussed this in big detail, and I hope all of you have already uh, reviewed this content. So what is journal data? As we will be not spending too much time on this section because you have already studied this. In journal data, you have to write name, age, nationality, and the place where he lived, native place, and date of admission, source of history, and journal marital status, occupation, current address, date of case record, and source reliability. So these all are in the journal data. And chief complaint, main symptom and duration, as just the main symptom and its duration. Simple word, no diagnostic terms or name of the disease. Always remember, chief complaint just only contain these things. For example, this 70-year-old man has shortness of breath for a week. So this is the simple, straightforward statement. So this straightforward statement is called chief complaint. And history of present illness is onset of duration, features of the chief complaint, causes of ailment and inducement, progression, and pertinent other symptoms, previous diagnosis and treatment, and general condition after illness. So this will also not go in much detail because we have talked on this already. Past history, past health status, past illness, operation, injuries, accidents, vaccinations, allergy. So this all you have to record. And review of system. So these are the main system that you have to review. Personal history like social experiences, habits, hobbies. This can also give you some clue, and you have to record in the medical record. Marital history, health of mate, number of children and their health status, and general social adjustment within the family. So these all are important. And then this one I have already last time told you how to record the menstrual history is age of onset and menstrual duration, interval between period like last menstrual period. So this all is how to write the menstrual history. Childbearing history, age of date of pregnancy and childbirth, abortion, methods of family planning. You have to also include in medical record for females. And this female history of illness, similar inherited diseases, this all family history, right? So family history can give you clues to some diseases that are familiar, right? And then it will be easy for you to diagnose them. And then physical examination in the and laboratory test and instrumental examination, you should have also to be right. So summary is this like name, gender, age and occupation, admission date, chief complaint, present history, simplified past history, simplified personal and family history, physical examination, and positive laboratory and instrumental results. Then after this all, you have to write the primary diagnosis, like etiological diagnosis, then pathological diagnosis, and pathophysiological diagnosis, stage or period, and classification or subtype, cardiac and pulmonary function and complication. And in the end of the history paper, you have to sign. Now physical examination. Today actually our main discussion will be on physical examination. So what the things in the physical examination you have to write, right? So what is TPRB? Can anyone tell me? The first thing you have to be doing.
Dada.
Check the temperature.
Okay. Good.
P for the pressure.
Okay. Good.
Respiratory rate.
Good. Okay. And B for
Blood pressure.
blood pressure. Okay. Very good. It's temperature, pulse pressure, and respiration rate, and then blood pressure. So these are the vitals that you have to record first. And then after that, you have to see the journal exam appearance. Like development, you see the development of the patient, how he is developed. Nutrition, well, moderate, poor. Um, how you will know the patient nutrition is well, moderate, or poor? Anyone?
Sir, by measuring BMI.
Okay, good. And
Checking their body weight.
good. And okay, very good. So nutrition, like even for example, you see some person overall once with one look you can even tell that is like body and okay, and other things is like how he is well developed, his body mass, he is fat, not fat, like these kind of his color. So this all thing, and then you check his body weight, his like BMI, these all things. So this will tell the nutrition. So how we will check the metabolic rate? We have never checked metabolic rate before. Anyway, we cannot see the metabolic rate, but anyway, just from these things, you can judge, okay? And then facial expression, acute or chronic, suffering expression, anxiety, fear, calm. So this all can also tell you the patient condition is severe, not severe. For example, is too much anxious and expressions are too much bad. It means his condition is not good right now. But if he is calm, he is fine. It means it's okay. It's not that severe thing. Position, gait, mental status. Okay, it's like very important. It's alert, obscure, lethargy, coma, cooperative. Okay, this well or bad. So this all is we will talk on when we will talk on the examination of the nervous system. And these all terms I will make it clear to you. Skin and mucosa. So skin and mucosa, what thing we will be like, seeing in the skin and mucosa is the color. Is it reddish, paler, cyanosed, okay, so yellowish, or any pigmentation on his body. So this first you will start on the first the patient, you see the journal appearance, okay, and then after that you talk to the patient and you find his mental status. The third thing you will be doing is just checking the superficial skin and mucosa, and then you will see the, if it's a baby for example, you check the skin moisture, elasticity of the skin, bleedings from the skin, any rashes that are on the skin, or any subcutaneous nodules, okay. And then spider angiomas, you can also look like these are the capillary, kind of bluish kind of raised capillaries on the skin. Sometime I will show you. And then ulcerations on the skin, scars on the skin, the location, size and shape should be recorded, because for example, if some kind of rash or something, its location will give you the clue that which kind of disease this person is suffering from. So elasticity of the skin, moisture of the skin will tell you if the patient is hydrated, not hydrated. Subcutaneous nodules will give you information about some, infections, malignancies, this all things. So this cyanosis of the skin will can also tell you like respiratory, cardiac problem. And if the patient is yellowish paler, it can also give you information about some fear, sometime anemia, and this all. Some kind of pigmentation will also clue to some diseases, right? So this is very important, that first thing you should be not missing any kind of these things. You should be writing in an exact order and their place, not to write yellow pigments on the skin. No, you have to write where you find like yellow, brownish, red pigments and which area of the skin. So for the medical record, this thing should be specified. And lymph node, systematic or localized lymph nodes should be like, for example, some in our clinical settings we quickly check is a submaxillary lymph node, posterior auricular behind the ear, right, neck, armpits, and then groin. So this one we quickly check, because these lymph node enlargement is very obvious, and then many like infections or something, these lymph node can get enlarged very quickly. So this data is also one of the important areas you should be recording. Its size, you should be telling that the size of the lymph nodes, numbers of the lymph node, and any tenderness, okay, because some lymph nodes can be tender. Sometimes we say if the lymph node is tender, in generally in the clinic we think it's a good, it's good, because when the lymph nodes are tender, it means they are maybe due to the infection. But when the lymph nodes are more rubbery, non-tender, they can be a clue to some kind of cancers or tumors, right? So lymph node tenderness, generally we take it as a positive sign. And hardness, okay, mobility, whether they are moving with their hand or not. So this all things. Okay, let's see. I think we just press on the face area or forehead, right, with the fingers. When you press on with the using your finger on the patient face, he will be, or near the nose area, beside the nose and these areas. So he or she will complain of tenderness, and this will be the indication of sinusitis. Sinusitis is actually the inflammation of the sinuses. So oral cavity, Oral cavity, you have to check is the odor is also important. Like, sometimes some bad odors can be indicating some, gastrointestinal diseases. Lips can also tell you a lot of information about the color, swelling, ulceration, herpes, and pigmentation. Okay, can you someone tell me what happens on to the lips after herpes simplex infection? What you see on the lips?
Sir, there will be cord like
Blisters,
Small pimples,
blisters.
small pimples.
Yeah,
Yeah.
good.
blisters,
Okay. Yes, very good. These are the small blister-like pimples, like mostly in the canthus, is like, on the it's not canthus, sorry, on the side of your, lips, or maybe sometime on the lips also. You can see white, small kind of, like, pimple-like things. So these are
Herpes
the,
also.
yeah, these are the, no, that is different thing. That is different thing. This is just small pimple, like, things. And teeth, you have to check. Gingiva, you have to check. Tongue, you have to check. Mass, ulceration, coating of the tongue is very important. Some kind of diseases can be, a clue there. And then mucus, rash, bleeding, ulceration, and tonsils and pharynx. This all is the contents for your oral cavity. So don't worry, it's just an introductory course now. When I will be there, and all of us will be there. So I will be teaching you this all things, how to check and what to check. Okay. And the next, you have to check the symmetry, texture. Okay. Thyroid gland size, hardness, tenderness, any nodule, tremble, any murmur. So now I have not taught you the thyroid gland. I will also teach you the thyroid gland diagnosis with the picture, how to palpate it, how to find its size, and this all thing. And superficial venous distension, we will also talk on this. Okay, chest. Chest, next is the chest. So we will see in the chest configuration is a flat chest or it is a barrel chest. Okay, symmetry or local protrude, anything protruding out from the chest, tenderness, respiratory rate and pattern, abnormal pulsations on the chest area, and also you have to check the breast, its size, its masses, any mass. Okay, it's not that mass. It means it's like, some kind of tumors or some kind of extra masses is appearing on the breast. So you have to check and record. And then venous dissension for hepatic cirrhosis. I'll not talk on this right now. Lungs inspection, you have to see again is a respiratory movement, interspace of the ribs, like you can check the in between the ribs, the spaces, palpation, the extent of the checks, excursion, vocal firmitus, pleural friction, tactile firmitus, subcutaneous capitis. I am leaving this all because when we will study the respiratory system, lungs examination, that time I will explain to you this all. Percussion, you already have a little bit idea about resonance, tympani, hyper resonance, dullness, flatness, this all. And then auscultation, you have to check for breath sound, tracheal deviation, auscultation, breath sound. There can be tracheal, bronchial, bronchovesicular, and vesicular. So these are different kind of sounds from the chest, right? And different area. When you put the stethoscope, you will find this things, right? So don't worry about this all because they will be coming in future lecture in a big detail. Okay, how much? 1 minute left. You can take is 5 to 10 minutes break, and after that we'll continue the other systems. Thank you. Any question here? Anyone?
No, thank you, sir.
Okay, it's little bit boring, but believe me, they are really important. Next future lectures will be more fun, more clinical, but these things is initial. You have to know these things. Otherwise, future lectures will be difficult to understand.
It's interesting. It's not boring, sir.
But maybe for some students, maybe they're thinking it's little bit like